White. My name is Mia. I'm going to be your nurse today. I noticed in your chart that you were due for a catheter insertion. Can I confirm your full name and date of birth?
Jacob White, December 31st, 1980.
Okay, and are you allergic to any latex or iodine?
I'm allergic to iodine.
Okay, so for this insertion and removal, I'm not going to be using iodine. I'm going to perform some hand hygiene. Put on a fresh pair of gloves. And I'm going to go ahead and set you up for the procedure. I'm going to lift you up to a comfortable working height. All right, I'm going to put you on the side rail. Pull down the blanket. All right, so I'm going to put you in a position with your legs slightly apart. The first thing I'm going to be doing, Mr. White, is perineal care. I'm going to take a warm washcloth and soapy water. And I'm going to go ahead and wipe the meatus and gland of the penis in circular motions, going all the way down. And then down the shaft. And then I would go ahead and use a dry washcloth and just pat it dry. All right, now I'm going to change my gloves, put on a fresh pair of gloves, and start setting up my sterile field. Hand hygiene. Garbage can. Put on gloves. All right. I'm going to set up my sterile field. I'm going to use this plastic bag as my waste and sharps container on the side of the patient for this scenario. Set it up right over here. Now I'm going to set up my sterile field. And I'm going to put on my sterile set of gloves.
It is him. I do it. I knew the shoes, so I was just wrong. Oh, hi, Henry. We need there's no bad. What are you guys doing right now? I just took an email about something. That's how what's we're doing right now. Did you do good? Yeah. Oh, I thought that. This is why I don't grab things from the garbage can. We always have to have in my car. I don't grab anything other. You guys have tickets?
Alright, now I'm going to set up my drapes.
My storage is just filled up. It isn't that.
Oh my gosh. If you want it, I would think you can use mine. Do you want to just like copy one and send it to you? I post it to my YouTube or like, I don't know how we do it.
Yeah, we can
airdrop it.
Him and I have the same YouTube.
Yeah, we just made our own YouTube.
We just have Alex and Rob YouTube.
That's hilarious. That's all you need is that.
Shiny side down.
You uploaded them and then I just made a YouTube.
Do you want me to grab my phone for you, Henry?
We'll probably do it.
Yeah, we'll probably
Yeah,
do it.
oh, you're using the bottom part?
Yeah, the bottom
We
part.
might end up using it. And you guys all have to go on this one.
We're not playing that. We're just here for
Or you will be done first. Okay. Can you do our video after you're done? If you want to do a video.
And then the last drape is going to go over the patient's penis.
Really scared. I really scared. I'm like, I feel pale. I feel pale. So, it's okay if you do our video on this.
Alright, now I'm going to set up my materials. Patient is allergic to iodine, so we will not be using them. Setting it off to the side. First thing I'm going to do is attach my port, my syringe to my port. I'm going to take the shield off the catheter. Put it off to the side. I'm going to pour my hydrogen peroxide on the cotton balls and fluff them up. Then I'm going to pour my lubricant, and I'm going to lube 5 to 7 inches of the catheter. So I'm just going to have it sit in the lubricant. Alright, so now I'm going to use my non-dominant hand, grab Mr. White's penis, and I'm going to take the tweezers, and I'm going to take a cotton ball. I'm going to go in circular motions and sterilize it from the meatus to the glands, using at least 1 to 3 cotton balls. Alright, I will also dispose of this in the sharps container. Now I'm going to take my catheter, make sure that the clamp is closed on the bag. Grab the catheter, and I'm going to hold it 2 to 3 inches from the penis. I'm going to ask Mr. White to bear down as if he's urinating, and then I'm going to pull the penis up at a 90-degree angle, and I'm going to insert the catheter 7 to 10 inches. And if I were to meet resistance, I will ask Mr. White to take a deep breath, and then I would turn the catheter if necessary.
So you go ahead and
Alright, now that it's about 7 to 10 inches, I'm going to insert it 2 to 3 more inches just to ensure that it is past the urethra. Okay, and now I am going to inflate the balloon. Alright, and then I'm going to detach the syringe. And now I'm going to pull back and check for resistance. Okay. Now I am going to take all the supplies away, and I would throw all of the supplies away. Throw everything away. Now I'm going to attach the catheter to the patient's leg. And Mr. White, would you like me to perform any peri-care after the procedure?
No.
Okay. And I would go ahead and attach above the Y and the port. Alright, and then I would attach the bag to the side of the bed. Then I will assist Mr. White to a comfortable position. Make sure that the wheels are locked. Call light is within reach. And Mr. White, is there anything else I can do for you today?
No.
Okay. Hi, Mr. White. My name is Mia. I'm going to be your nurse today. I see on your chart that you are due for a catheter removal. Can you go ahead and confirm your full name and date of birth for me?
Jacob White, December 31st, 1980.
Okay, and are you allergic to any latex or iodine?
Just iodine.
Okay, so for the removal, I will not be using any iodine today. Going to perform some hand hygiene. Put on a fresh pair of gloves. And the very first thing I'm going to do is put a chucks on the floor. For this scenario, this is going to be my chucks. I would place it under the urinary bag. And I would empty the bag into a graduated cylinder and look at the urine. And what I would be looking for is the color, amount, clarity, and if there's presence of any odor. Then I would empty it. Now I'm going to go ahead and lower the rail. Move the blanket. All right. I'm going to take off my gloves. All right, Mr. White, I'm just gonna spread your legs a little bit, and then I'm going to remove the catheter from your leg.
I felt it because I was like, no way.
We're gonna pretend like that went all the way into this one, but unfortunately it's not working. So, I put 10 milliliters in.
Okay, now I'm going to put on a fresh pair of gloves and perform hand hygiene.
And then I will do a little tug test to make sure that it's in there. Alright, so now that we have inserted, we're just going to...
And I'm going to place a chucks under Mr. White.
I didn't even clean. I didn't even sanitize.
She didn't do it. Tongue swabs. I didn't even tell this guy cussing every 5 seconds.
It's not going through.
Forget about that.
All right, Mr. White. I'm going to attach the syringe to the port and allow for the syringe to fill using gravity. All right, Mr. White, now I'm going to ask you to take a deep breath while I remove your catheter. I'm going to hold the penis with my non-dominant hand. My dominant hand, I'm going to pull gently and swiftly, coiling it around my hand. You did great, Mr. White. And then I would throw all of this away. Would you like some perineal care?
No, thank you.
All right. Cover Mr. White back up. Put the rail back up. Lower the bed to a comfortable position. Make sure that the wheels are locked. Call light is within reach. And is there anything else I can do for you, Mr. White?
Nope, that'd be it.
All right.